The title of our next presentation is Artificial Intelligence in Medical Education, Empowering Medical Education, Exploring the Transformative Potential of AI. So we've got here with us today Quincy Conley. Dr. Conley is the director of the Teaching and Learning Center for ATSU. I think he's located in Mesa. Are you?
I'm everywhere.
Everywhere. He's everywhere. He services all of the colleges of the university. The Teaching and Learning Center, you get some emails from them from time to time. If you haven't checked that out, whenever you're in the ATSU portal, you can get in and access that and take a look at it. We're glad to have you here today, Quincy. We've also got Julie Speer, PhD. She's an instructional designer for the Teaching and Learning Center. We have Dr. Hanan Omar. She's the Assistant Dean for Research and Professor at the MOSDOH, the dental school here at ATSU. And so we're delighted to have her with us. And Dr. Misra, our esteemed Associate Dean of Clinical Education, joins us as well. You remember from your emails that you got, and we sent out the link to the podcast that they did. I think it was earlier this year. Yeah, in the spring. There were 3 podcasts, and if you listen to those and attest on the attestation form, you'll get 3 hours of CME for listening to all 3 of those podcasts. This will be similar to that experience, but they're going to bring new information for us here today, and so I'm going to turn it over to them for a panel discussion on AI.
Thanks, Dr. Davis. Appreciate you. Thank you very much. So last night I got my hands on the agenda for today. And I looked at what sessions were before and after and tried to think of a transition. I do not have a good transition to go from very serious topics to talking about AI. So if you have one, hold it up on cue cards. I'd be happy to read it. Otherwise, make one up for yourself and we'll plug that one in. So my name is Quincy. Traveled here from Mesa campus, but we're virtual. We come out here whenever we can. And my pronouns are he and him. And today we're going to talk about something hopefully near and dear to you. You might have heard about innovative, right? It's changing the game. PowerPoint. So thanks for being here and talking about PowerPoint presentations in education. Before we get into what we plan to talk about and asking our panelists questions, I'd like to ask you some questions. So if you have your device, please break out your device, your laptop, your iPhones, your pagers, if you have them still, or your cell phones. I have some questions for you. Either follow the website here, slido.com, and enter this code. You should see 2 questions. Please take a moment to answer those questions for us. And also, you can use the QR code by pointing your camera at it. It should pop right up for you. Let me know if you don't see it. I'll come around and help you. Additionally, what you should also see besides 2 easy poll questions is an area to ask your own questions of our panelists. Feel free to add them. I'll come to you. We'll bring a mic to you as well if you would rather use the mic and ask your questions. So take a moment to do that. And before we get into asking you questions, just want to set set the tone here. And let's see who we got. 11 people answering the questions already. Hopefully y'all can see this. Look at that. We got some folks that have not yet used it, but we have some that have used it every day. All right, fantastic. I use it probably once a week for different reasons. To turn off my subscriptions, I come up with an email and send that out. It does that very well for us. We'll give that a few minutes. So while you're answering these questions, the purpose of today is just talk about OpenAI specifically and how it might be impacting medical education. We've been working together for over almost a year on this topic. There's 2 main trends that we're seeing. We're seeing that medical education curriculum could be changing as a result of this OpenAI technology. And we also see it as an opportunity to personalize the learning experience. Some of the topics, some of the themes have popped up already. How do we better relate to our students, meet them where they are, to be able to get them through the curriculum, right? So we got about 36 people that answered this question. This is fantastic. Keep doing that. Love it. we'll come back to it. And then as far as what is the potential, this is awesome hearing from you, what you might think of AI, OpenAI. Good, awesome, absolutely. That's a good thing. If you were saying scared, bad, terrible, we would have a different conversation here today, maybe. But yeah, maybe useful. I get it. We're trying to figure things out. We're trying to see what the impact might be. Valuable, inevitable. Yes, good point.
Like Thanos in the Marvel.
Exactly. Exactly. Yes, it is. It feels like that. It felt like November, January. I don't know when you became aware of it. It felt like I woke up one morning and the world was different for sure. So here we are a couple months later. But yeah, a lot of great adjectives here. Thank you for weighing in on these things. And please feel free to ask questions on that poll as well. So to make sure we're on the same page here about what we're talking about today, OpenAI and this infamous term ChatGPT that we're all hearing about. I believe it's been a game changer. If you listen to the podcast where our guests talk about these things, it just revolutionized how we interact with the technology. So what is OpenAI? Anybody have a guess? What is the technology? A large language model, right? It's a big giant algorithm that processes information and spits it out in a way that it's almost like a text conversation. And recently they even made it possible where you can come up with tables and images and all these other things. It's taking information in this form of conversation and turning it into something on the outcome. So hopefully we're all on the same page here about what is OpenAI, in particular ChatGPT. So let's talk about it. I'm going to ask the first question of our panelists. Panelists, if you be so gracious, I will call on you and that you will introduce yourself, share your pronouns as well as your affiliation and maybe where you traveled from to be here. All right. So Dr. Omar, if I may start with you on this first question. So I know you all have been working on this. I'm curious to see what your perspective is on how ChatGPT can be effectively integrated into medical education in general. What do you think?
Okay, first, thank for inviting us to be here today. I'm Hanan Omar. I'm from MOSDOH. I traveled from next building. So, so that was not a long distance. So when I was first introduced to the idea of artificial intelligence and ChatGPT, I was like, I thought it's amazing. It has a lot of potential. It can change the education as we know it. It can be, if you give it another name, you can say calculator. Do we remember when we started using calculators and the exam would say calculators are not allowed, and then calculators are allowed for question 1, 2, 3 only. Then after that, everybody is using calculators. And I believe that this is where artificial intelligence and ChatGPT and language models will be reaching, where everybody will be using them on daily basis and for most of the encounters. I would just like to reflect on how ChatGPT can be related to educational theories. And it could be rooted mainly to 2 educational theories, which is constructivism, which is more about student-centered learning. And this is where what Quincy referred to as adaptive learning. So the students learning at their own pace. They are in the center of the learning. And this is what we want to achieve, and we are trying to achieve every day. The other theory, which is the cognitive load theory. So we are not stressing them. The way they interact with the AI is not having excessive cognitive load. So they are trying to slowly learn and achieve their learning outcomes. So this is where I see the ChatGPT and the artificial intelligence will support the learning.
Dr. Speer, same question. What are your thoughts?
Well, hi, everyone. And again, thank you so much for having us. I, like Quincy, traveled from Arizona and my pronouns are she, her. Agree. I agree with all of that. I think something I'll add here in the same line of student-centered learning is kind of the inquiry-based approach that it can offer, right? So students can have a question, they can go and kind of play in the system here and get immediate feedback. right? And I think those two things, the kind of the inquiry focus and the immediacy of that feedback, and especially in classes that have 70, 80, 90 students, it's really difficult for one instructor to give an answer to every student's question as soon as it pops into their brain. But I think that one of the things I really appreciated hearing about, you know, these conversations about AI and ChatGPT specifically is how students can use it almost to explore or experiment. What happens if I phrase something this way? What happens if I'm faced with this scenario, right? We just heard all these scenarios, Title IX, right? What if it's this? Is that a Title IX? What if I change one factor? And so the opportunity for students to really explore, be creative, but have that brains-on critical thinking approach as they do that, I think is a really amazing opportunity. I think intentionality comes into play, right? We want to teach our students how to be intentional with this, not to just, I mean, right, you don't want to just Google the first thing either. So I think that intentionality piece, how do we build it and bring it into the curriculum in a really intentional way, that leverages, I know we saw on the last slide with the word cloud, both the good and the bad, that double-edged sword, I think someone wrote. I think that's important to keep in mind.
Awesome. So, Dr. Misra, I have a different question for you. So
Sure.
we have folks that teach in different ways, coach, mentor, and help with the training. So what are some of the challenges that you're seeing across the different environments in medical education? What do you think that we should be prepared for?
Well, so that's a really good question because, I think inevitably, as we saw from the word cloud, many of us feel cautiously optimistic about the use of this. But there is that caution, and the caution is well justified because there are a number of things that we are still trying to identify and define with this extremely powerful tool. Not just that we use it, but in what way should we be allowed to use it, right? From an educational standpoint, I think Julia alluded to this. How do we make sure that using AI and large language models is meant to supplement what the student is already doing, as opposed to replace the student's own effort and intent, right? And also making sure that in this process of using this, we often forget, because we are educational and we're very focused on the educational process, that at the end of the day, this all exists for patient care. And so we have to recognize that as we start to use models like this and we start to look at the data these models are compiling, are they compiling accurate data? Are they compiling data in a way that is protective of patients' privacy? And are they then providing information back in a way that recognizes that? One of the most interesting things that we're seeing right now is that many of these large language models are, if we have this conundrum, if we want good information that is not biased, we have to be able to pull in a lot of information. And if we are pulling in a lot of information, we have logarithmically greater risk of breaching patient privacy and confidentiality. But if we don't get a lot of information, then we run the risk of having bias in our answers. So, for example, if you program or work with an algorithmic system that has only looked at, Indian males, between the age of 40 and 60, and you start asking that system for information about pregnancy, I realize I need to lose a little weight, but that's not going to really work, right? So the question really becomes, how do we make sure that the data that is being given or fed to these systems is accurate, comprehensive, and then how do we make sure that we do that when it comes to patient information? Those are the two biggest issues I see right now.
Excellent. Excellent. Thank you. Dr. Omar, care to weigh in? What are some of the challenges that we should brace for, would you expect as educators?
I would believe that we should look into educational patterns and who really needs to use ChatGPT and to what level, because we don't want the students to be engaged in a conversation with AI that is not leading to enhance their educational experience. So a process of monitoring and a process of understanding where the students are heading with their learning and identifying their cues, their questions that they are asking. That's a very important step towards knowing whether they are learning what we want them to learn and how this impacts patient outcomes.
Awesome. Yeah. So not over relying on the technology itself for the learning process. I love that. Absolutely. Okay. Another question here, Dr. Speer. Do you have some concrete examples in mind of how you're seeing AI being implemented in education?
Yeah, I have a couple. And in fact, I've been working with a physical therapy faculty member on the Mesa campus for a project in her class. And so she teaches documentation. It's one of the first classes that her students in the DPT program take. And she came to us and she's like, all right, so my class is, they don't have clinical reasoning skills yet, right? So my examples have kind of boring and no one really loves to learn documentation anyway. So how can I, keep my class engaging, keep it exciting, and help my students? Because what she's noticing is they really turn their brains off, right? It's like, okay, this just goes in this section and they're not really thinking. And so specifically, she had, teaches a lesson on writing SMART goals for patients using that goal writing framework. And we developed an activity where her students would probe ChatGPT to tell them about goal writing, about SMART goals. This is a well-written, I mean, to your point about bias, right? If there's not information out there, it can't do a good job, but there's a lot out there on how to write SMART goals. So they, instead of a lecture, instead of pre-reading, we had them come to class with their laptops and tablets and ask ChatGPT questions. And then we had them ask ChatGPT to generate scenarios for them. And then based on the scenarios, they had opportunities to practice writing the SMART goals and then getting feedback on them. And when we were going through this, we really asked them to, we prompted them for that critical thinking. Do you agree? Why do you agree? What ways would you change it? And so I think that intentionality piece that I was talking about before really shine through in that example, because we wanted, we did a clarifying lecture. We didn't just, assume that it was going to give them right information, but we wanted that to be kind of that inquiry-led process that they could ask their questions to ChatGPT. They could get that feedback. So I'm happy to talk more about that project, but I think that's one kind of didactic, clinical, didactic but clinically relevant example. I mean, there's so many, so I'll pass the mic metaphorically, but just one.
Okay, I'd love to hear from everybody on this question. Dr. Misra.
Yeah, I think that's a fascinating one. So obviously I sit like many of you in the clinical world, and I've been looking at where do we use this. I'll give some perfect examples that we've started to do in our residency program, but I think can apply equally to a student environment. So for example, we were redesigning our hematology oncology rotation for our residents. And so we asked ChatGPT to develop for us a set of learning goals that are progressive for a year 1, 2, 3 resident. And then it was able to spit back goals. And then we use that as the basis for having a discussion. But I think one of the interesting things is so many people in the clinical world worry about the heavy lift that comes with developing educational content, right? And I think where ChatGPT can be particularly useful is doing some of the groundwork for you, essentially acting as an assistant to collate the information. Now, the caveat to that is that you can't just use it by itself. It's meant, I think once that information has been pulled together, the critical part we all agreed in our program was the discussion that fed from that, right? But for you who are working with students, you may be thinking about that. I have another example that I'll share with you, and this is one you can all try if you want. So you want to go to your app store, and there's an app called Human DX, okay? And you can download this app for free. There is no cost to use it. And Human DX is actually a large language model collaborative effort to try and design better diagnoses by using what AIs know combined with what we guess and what we tell. So it'll put up cases and things like that, and it has 8 sequential clues. And then it asks you to provide your potential diagnosis based on the clues given. And then what the AI is doing is it's parsing this information to understand how we think, so that we can come to a better place in terms of making more accurate clinical predictions about what's going on. So that's almost like using AI in the background to better understand how do physicians think to better predict. And that makes sense. If we want AIs to be smart, we need them to learn from really smart people, which are the clinicians that are already out there practicing. So I think it's a fascinating program. I highly encourage you to look at it. There is another program called DX Learn that is being put together now that, going back to what Julie was talking about, what you were talking about, is designed to actually present cases to students and ask them to sort of examine the case and examine the patient. And it gives them access to the radiology report. And then it says, okay, provide your interpretation of it. And then it tells the student, here's where you were learning things. And then based on that, the next case plays to the areas where the student may be struggling, right? And focuses it. So, okay, you're doing really well with understanding how EKGs work, but maybe not so well with how X-rays work. So let's give you another two cases that have critical elements related to the X-ray, right? And that goes back to what you were both talking about, this customized sort of learning process that, to be very honest, a clinician can't do with 17 students, and a basic sciences faculty couldn't necessarily do in a time-efficient manner with 50 students. So those are two examples I think are fascinating.
That's excellent. And if I may, before Dr. Omar, before weighing in, one thing I really like, I'm maybe teasing out a little bit, is AI might allow us to train things, especially at the early stages on things. Before we can do something, we have to know something, right? Our students have to know something. So maybe this is where it's effective, at least for now. And the second part of that is the AI maybe not replacing us, but maybe helping us do the thing that was more human-like, right? The connection, the interconnections, being able to make those type of decisions. So I appreciate you sharing those examples. Dr. Omar.
Yeah, in our program, we have a series of standardized patient encounters, and one of them is about that the students need to discuss with the patients their smoking habits and tobacco habits, and educate them about how could this impact their oral health. So as part of the pre-encounter training, we have some educational materials, and we have reading resources for the students. So for this round, we have looked into asking each student to use ChatGPT to develop a concept map on how they approach a patient who has tobacco or who is a smoker, and look into various aspects that they will encounter and use in their actual SP encounters. And with these maps, we have provided them with learning objectives, and we have requested them as part of the assignment is whatever information they obtain from the ChatGPT, they have to verify that and identify resources that supports these information. And then after that, we have a pre-encounter quiz, which is about the knowledge, and a post-encounter quiz after they meet with the patient. So we found that in this group, they have a good understanding of the main concepts, the impact of smoking on oral health and periodontal condition. So we believe that there is a way that we can incorporate that, as long as we are clear about the learning objectives. And at the beginning, maybe it's a controlled educational environment.
Excellent. What I love is you mentioned at the beginning about how you believe in constructivism, the idea of connecting new information with what they already know, what our students already know. And so this concept of concept maps is that, could you elaborate on that idea of concept map?
Actually, we would ask the students to look into certain aspects. Like they start with a patient who is a smoker, which is the center of the concept map. And then they will, based on their understanding of the topic, they will branch that out into patient age, patient education, impact on oral health, psychological factors, behavioral factors, and they will have a map about this. And then from this map, they will identify the areas that they will counsel the patient about based on the findings.
Excellent. Thank you. Now's a good time. If you have a question, we'd love to hear from you. We got our first question that came in. Wikipedia. What is the comparison, right? There's a question that came in about this idea of how do we trust AI and ChatGPT? We're talking about going towards these things in a certain way, but not that long ago, never, as instructors, I did it myself, stay away from Wikipedia. What are your thoughts on that? Dr. Speer, you take it first.
Yeah, I mean, I think that's an apt comparison that we can all really relate to. I think the challenge in the early days of Wikipedia, right, was like no one knew who was editing, how valuable or validated that information was, and I think we're seeing some of those same concerns with ChatGPT, especially with ChatGPT because it can hallucinate and can do these things where it'll just tell you a citation that's unrelated, or it'll just put information because it's predicting what word should come next based on what it's learned, not whether that's an accurate statement to come next. So I think I think that is a really good comparison. I think we'll see over at the speed it's going, probably weeks to months. You know, there's literature constantly coming out validating, you know, how accurate were the responses, especially in healthcare. You know, there were studies I had read around vaccine communication and whether it was providing biased or unbiased information about COVID vaccines and all of this. I think that what, as an educator, I would and do think about is how do we train students, like Dr. Omar said, how do we train them to go check on the data, which was what we would want them to do with Google, with Wikipedia, with any other resource, right? So I think it's that encouraging students to be good information consumers and stewards, and thinking about how do we scaffold this, how do we model it for them? And, you know, with your example, Dr. Misra, of the that diagnostic app, could you use that with your students and sit down and say, we're going to look at this case. What do we think? Do we agree? What's the next thing? And then compare the results that you're saying with your years and years of experience against the app to say, okay, we can maybe think about it in this way versus this way. Are we using it to write an email? Or are we writing to go tell our patients some bad news, right? Those are really different scopes. And so I think it matters what it is you're asking it. But I think this is something we want to be cognizant of, is what data is it trained on? How well is it pulling and informing its responses based on that data? And I think we'll see, you know, as they move forward, are they updating, you know, how is it now informed by our own questions and our own responses? But yeah, I really think about information consumption and stewardship there.
Yeah, I think it's so important. You know, my favorite T-shirt that I ever saw said that it said Abraham Lincoln was the greatest president of the 22nd century, and then it says in a small asterisk, citation needed, right? You know, and I think that goes back to this concept about Wikipedia, that, like, you know, and by the way, the medical equivalent of Wikipedia, does anybody know what it is? It's up to date. Right, up to date is the medical equivalent of Wikipedia, right? It's curated knowledge, and our students tend to use it the same way the lay people use Wikipedia. Go there, read whatever it says. That is the breadth and scope of information. Whether it's valid, whether it truly is the breadth and scope, seems to be a secondary thing. So what can we do? Because I'm, again, a very okay, that's really important from a theoretical high-minded, but what can we do? And I think that Julie just hit upon it. I think that you all need to start using it. So ask questions of Chat GPT, right? Run a scenario that you're dealing with the patient through it. See what the answers come back as. See what you like about that and what you don't like about that. How does that change your thinking as a clinician? And then take that same case and rerun it with students. When students see ethical and effective and professional role modeling, that is often one of the best ways for us to train our students without training our students formally. That being said, I think there's a real need for formal training of and it really has to start, I think, at the basic science level. We are not, you know, it is inevitable. We are not going to get away from this technology, and we need to really start integrating ethical, effective use as a concept for our students early on in that regard. The last thing I'll say about that is that, you know, my favorite joke ever comes from the Pink Panther movies with Peter Sellers. And there's a scene where he comes in as Inspector Clouseau, and there's this 80-year-old caretaker with a dog. And he goes, "Excuse me, does your dog bite?" And the guy goes, "No." And so he goes to pet the dog, and the dog bites him. And he goes, "I thought you said your dog didn't bite." And the guy looks at him and he goes, "That is not my dog." And the point there is, it really matters what you ask and how you ask ChatGPT,
Wow.
right?
Yeah.
Because that is where you're going to get either really good or really bad, or worse, really useless information.
Great point. And another question has just come in right on this topic about who polices AI as we know it today. Anybody have any thoughts on that?
I'm going to answer that in a roundabout way, which I think right now is that as educators, I think we're often asked to police students' use of AI, which I know is not the question, but I'm going to do a diplomatic answer here. I think that there's so much question around, oh my gosh, are my students using it? I have to catch them using it. I have to go find these AI detectors, which are not good. Right. And it's going to turn into an arms race, right? It's going to be the at some point the detector, right, can detect to this level, and then the AI is going to get better, and then the detector is going to get right. So it's, you know, kind of this inevitable kind of arms race there. And I think that for me personally, my concern is less on trying to detect and more thinking about why do students cheat? Right? Why do students go to a place where they're going to just copy paste from Google, or they're going to, you know, ask their friend for the answer? And it's often because the assignment isn't aligned, or the expectations are unclear, or the content wasn't delivered effectively, and students are stressed, right? And so I think if we think about that first, and then think about, well, rather than me just saying you fail, I mean, there was this classic case, right? I think it was Harvard law. The professor failed everyone in the class because the AI detector said everyone had used AI, and probably most of them hadn't. So rather than go to that place, can we say, let's have a conversation at the beginning of an experience, at the beginning of a class or a rotation? What do you perceive to be ethical use of AI? Do you want your students never touching it? You need to tell them that. Do you want your students using it, but then everything they turn in should be in their own words? You need to tell them that. And I think that question becomes, right, students have access to it, but it's incredibly confusing for students if they don't know instructor to instructor or director to director how this is going to be perceived. And students are very fearful. Right? We know they're spending a lot of time on these studies. They're spending a lot of money on these studies. There's a lot on the line. And so I think the policing, again, a roundabout way of answering the question. But I think the policing question is one that we're constantly hearing about in the education spaces of how much do we police AI use? And I think it's important to talk about.
I will say so you can look up, there are many organizations right now at a large countrywide, worldwide level looking at this same question. The National Institutes of Standards and Technology right now is putting out their first version of ethical use of large language models, but it's general, right? What we also need to look and see is what medical organizations, because that's the domain we're in, healthcare, right, and healthcare provision, and what organizations are doing in that regard. And that's where you may look at groups like AMA, AOA, the American Board of Ethics, and those kind of things. And they're starting to put some of that out. And you can be part of that conversation too. So that's the macro level to the micro level of the student encounter.
Thanks for sharing that. We have some great questions coming through. Dr. Omar, a question here is about usage. So currently 3.5 Elemental P is available and free. And there's a new version that's out for a small fee. As educators, we're being encouraged to go towards these things and use these things. Do you have thoughts on accessibility, equity of access to technology? Any thoughts on that so far?
I believe that at this era and at this point of time, we all have access to this technology, or most of the students, and especially in the medical and health field. But it is important also to understand the use, the pattern of using amongst the students and amongst the faculty. I believe that it carries a great potential, but it also at its infancy stage, where we need to look into what the questions are being asked by the students. And I believe we need to, as Julie mentioned earlier, we need to rethink our assignments. We need to rethink our assessment. Are we asking them to just write, or are we asking them to critically analyze? So when they use the artificial intelligence, it's going to support this process of critical thinking. Not it's going to just be getting information and not being able to process these information.
Right. I love your calculator analogy is, 2 + 2, if that's what we're trying to learn. Don't let the computer, the calculator do that for us. Take it a step further, right? Is there something deeper? Yeah, I love that. Any other questions anybody else want to ask? I'll continue to moderate the list here. Any other questions coming in? That was a good question. Is anybody using it in their instructional approach? Anybody besides Steve? Got a couple people using it. How are you using it? Which version are you using? Okay. 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 Oh, wow. Okay. Okay. And remind me of your name, Chris. For those who are listening at home, to rephrase what Chris said, ask the question: is anybody using this? He said yes. He's using it for his instruction. But yeah, that's a fantastic example. Taking it to the next level, we got code. It's being vetted, and it has a specific purpose. It sounds like that's fantastic. Saw some other hands, other people using it. Yes, yes. How are you using it, and how are students accessing it?
Selfish using it. I have a second-year daughter, and she can understand renal hypertension growth. So I just have to generate complex style board questions, renal hypertension. Yeah, and spits out cases. Then she told me all the friends don't understand it either. So I just put those into my renal lecture. But because there's so many books you can go to that look up a board question, and then I have to make it, and there's always something wrong with it. So just keep regenerating. So.
Okay. So you and then you feel it's accurate. You feel like you're agreeing with what you're presenting. Okay.
I understand, horizon, all that stuff. I think so. A lot of basic science is kind of reduced all those sometimes.
So it's helping you critically think as well. That's awesome. Okay. Very cool. Anybody else? Yes.
So my name's Rich Bear.
Thanks.
And, in the spirit of active learning, through the course of the presentation, I signed up to ChatGPT and entered a question for family medicine residency outline learning objectives for nursing experience. And it generated something that really isn't very ballpark. But now, from a learning perspective, I'm really curious about, okay, let's go to my example, other examples here. What is free? Is there value here? Is there something that I didn't consider and where that it actually enhances required value?
That's a great example, right on the fly. That's fantastic. Thank you for sharing that.
Before you get to the next one,
Yes.
so here's a really interesting thing to try, and I encourage you to do this when you're doing something like what Dr. LeBear said. Ask it the same concept, but ask a different way. And because that's where you start to see how the large language models can process different queries and yield different results. So I guarantee you, if you ask it that same idea, but ask the question differently, you'll get back some additional pieces. So it's almost like getting 3 or 4 large learning language perspectives. So it's an interesting idea. Right. Yeah. Or ask what does a resident, what does a young physician need to know about caring for geriatric patients? Right. I mean, it'll be fascinating what you find.
And oh, sorry, I'm just going to piggyback. I think one of the best things, if you're, starting to use this and try it out, is to not only play around with how you ask the questions, but look at good examples of prompts.
Yeah.
So I think you alluded to it earlier, kind of good in, good out, bad in, bad out, right? If you ask a kind of generic question, it can probably going to give you a generic answer, versus the more specific you get, I'm a residency director. I would like to generate learning objectives is going to be potentially different than just write learning objectives.
Awesome. This is awesome. A question here, and then I'll come over there. We see that. We
Yeah,
see that
it's-
coming. Oh, go
It's
ahead, jump in.
interesting to some extent. There's a lot of controversy surrounding this exact topic right now because those works are. Oh, I'm sorry. Is the microphone? Can you hear me now?
Repeat what her
Oh,
question,
to
her
repeat the
comment
question.
was.
So the question, I'm sorry for those listening at home. The question was, is it possible, like, for example, a student could be asked to, read a chapter of a textbook and come up with thought questions or learning points from that. And the assumption is that the large language model would have that resource and be able to sort of collate that. And there's a possibility. Remember, with ChatGPT 3 and 3.5, it's 2 years behind what's out there. So if it was a more current textbook, it might not work. But the question becomes, who owns that content? And if ChatGPT is pulling content from there, is that plagiarism? And that's been a big question that has come up because there are authors who have actually sued OpenAI, the company that makes ChatGPT, because they're saying you're accessing my original copyrighted content for the purposes of doing something else, and that's expressly forbidden within the constraints of my copyrighted content. So it goes back to we might be able to, but is it ethical to do so?
And that question came up about 13 times here, about do students have to report? Do they have to disclose using AI? I would say that's being to be determined.
Yes.
But I have noticed that some of our citations for scholarly publications, they have come up with a policy. Is anybody seeing this?
Mhm.
Where if you used AI, you name them as a co-author in some cases, or you cite them in a certain way. But that's controversial, right? I would prefer to go to the original source, right? Whatever the topic is, give you all credit, right, for the thought as opposed to AI. But that's a real controversial.
I second that the original source is the main source, and Julie has mentioned that ChatGPT hallucination, and it is there. Like, you would provide the reference and the resources and ask the ChatGPT, and the ChatGPT will be responding in its own thoughts or ways that might be different from the original source. So that is something that we have to be very careful when we are getting wholly the resources from ChatGPT. And again, for copywriting, you would rather go to the original source or the original textbook. That ChatGPT can enhance understanding of a topic because it has a lot of information from other resources rather than relying on one resource through ChatGPT.
Yeah, I suspect when you start in the next 5 years, you're going to start looking at research papers, and in the methods section, there's going to be descriptive elements related to how was a large language model utilized in developing criteria and stuff like that. And I think that is very important to say, like the large language model was used as a starting point for educational search with resources identified and then independently confirmed through, that. That's what I think has to happen.
Good questions. We had a question here. I want to get to, and then we'll go there. Yes. You're making a lot of eye contact here that I'm not comfortable with. We have some really important people in the back of the room that I would like to flip that to. Good question. This is a real, I want to validate this this is really important. We get this question a lot. We see the groundswell around this topic, and policy is being developed, procedure as we go. But yeah, do you have a
So I think this is a place, and I would love to hear the dean's thoughts on it, but we have general policies already in place about ethical and professional techniques and educational techniques. And broadly that falls under that, right? So use of assisted models and things like that to supplement, to supplant your own work would violate those tenets of professionalism. But I'm not sure, Dean, if the university has really wrapped their head around how to do this, not just for our case reports, but really for anything that falls in this domain.
I think it's something that's come up in discussions. I think it's something that needs to be, discussed at curriculum committee and within, kind of the greater context. As we stand today, I would say I'd have to go back and read our ethical policies, but we probably would, lean towards not perhaps allowing that, but I'll have to reread that. I'll get with Dr. Trish later today and see what she knows, and maybe she can talk a little bit more about it tomorrow morning regarding, and I know of nothing at the university level. Quincy, you might.
Yeah, there are pockets of departments across the board that are dealing with this in different ways based on their current needs. Some have already come past the board season where these things have come up, and then some are more, discussion board based. Some of the online places, programs, as well as some of our EDD and doctorate programs where they're working on their ERPs, their research projects. They tend to rely on their academic integrity policies. Then outside of the university, right, there's some schools that are taking an approach like we'll take it case by case and are dealing it with that way. And then some people are just saying, wild west, figure it out and going for it. But yeah, maybe this is our next panel discussion, is how to come up with a policy for something that's changing almost every day, right? It might have vision here soon, right? Where it can look at your paper and then come up with an answer for you. That's next, right? But good questions. Yeah, we have another question.
I was just going to say, I listened to a podcast also that made me think a little bit differently about it, because don't we all use the internet as a resource to gather information to write a scholarly report? So don't we look at UpToDate? Don't we look at Dynamed? And how is reading that stuff and then regurgitating it any different than asking ChatGPT to give you this information, reading it, and then regurgitating it? It would be one thing to use exactly what it says and without changing anything, but that's what we do. Even if we read a textbook and we put it in our own words as part of a research project or anything, ChatGPT can be doing.
It sounds like the risk is not using ChatGPT, but it's rather taking literally what ChatGPT says and turning that in as your original work. In general, my feeling is have them identify their sources. That's a good stop point.
Or sharing the code. So you can now share the chat. So I know a lot of educators are saying you can use it, but share that link with me so I can see what you asked it, what you got, and how you then modified that and interpreted it.
Yeah. Sharing the prompt is very important.
Yeah, that's best practice, because that goes back to transparency, right? Which is critical in medical care.
Just to kind of follow on that, personal statements for ERIS definitely have had some come through within our residency where on paper someone can look so eloquent and I'm like, this is amazing, and in person I just don't see that person. And so I also know that I review personal statements and make additions, and so I'm like, well, what are the limits, right? Yeah, what are the differences? So how or what do we recommend counseling students on the use of this for the development of their personal statement?
So I've dealt with that because I work through a lot of personal statements with a lot of students and residents applying to fellowship. And my answer has been pretty consistent. I'm an embracer of technology. So I say, if you want to use ChatGPT to start a basis for a personal statement that you want to make, I think that's great. Go ahead. But realize that if you don't spend extensive time editing that and looking at it and doing that, then really it's not going to be reflective of you. And programs are going to understand that. They're going to see that. And I'll give a perfect example. So I was asked to give an award speech at a particular ceremony, and I chose to use ChatGPT. I said, write me a 5-minute speech that recognizes winners of this award. And it did. And then I still probably spent maybe about an hour and a half rewording. I would say when all was said and done, I reworded about 60 to 65% of what ChatGPT did, because I was like, that's not my voice. That's not my voice, right? That's not how I would say that. I like the idea, but it's not how I would say that. And then I gave the speech and it was well liked. But there was one individual who came up to me and said, you know, that was a wonderful presentation or wonderful speech, but there was something, I can't really put my finger on it, but there was something a little off, and it wasn't exactly your voice. And I think the point there is that when you're talking about personal statements, the key word is personal, right? And so if you allow something else to tell your story and your personal voice isn't editing that story, do you really want that to be what the residency makes a judgment of you on, right? And what does that say about your confidence level in your own personal, confidence in yourself? So those are questions that really got my residents thinking about, like, how do I want to use this? And that would be my advice.
Great point. Any other questions from the audience? Some great questions here. There's some technical questions too about the technology. Any other questions? How are we doing on time? 5 minutes. All right, we'll blow right through this. Question for you, Dr. Omar. I want to talk about, well, I kind of connect into your question about how AI, the idea that equity and inclusion, access to this technology, not everybody has reliable internet, not everybody has reliable technology to do these type of things. I know, mobile phones is very pervasive and that is available on your mobile phone, but maybe is this, I ask a question back, is this really the case of being less of how well you write and critically think? Is it how well you use technology to bring in information? I think this came up in a different way about using the internet, bringing in resources to be able to tell a story in a way that might be new. So is it an adaptation of our ability to evaluate people instead of telling a story about their altruism? Instead, it's how well did they proofread this? Now there's no excuse not to proofread it if we're saying technology is available, or do we need to come up with another category? Did you use technology? Did you use AI to do this? What do y'all think of this? Thumbs up, thumbs down? Changing the conversation.
There's a hand up in the back.
Yes.
Yeah, all of this computer technology, a lot of students have lost their ability to critically think, because the first thing you ask them, they go to their phone or they go to their computer. They don't read about it. They do not know how to be critical thinkers. They don't know how to stand on their feet. They get in an emergency situation and they lose that ability to function. And somehow we have got to steer them away from relying on so much AI at their fingertips.
I want to, and I love your comment, and I want to respond to it. Respectfully, I think the goal is not to steer them away from it. I think the goal is to show them how it can augment their ability to become better critical thinkers. So one of the real problems, to your point, is that in that scenario, what happens is the student is, again, replacing their own internal ability and skill and autonomy to critically think and taking whole scale what is given to them. And what we need to do a better job of is to your point, is to craft better experiences, learning experiences that allow them to leverage the technology, but ultimately the output is theirs. So it's not about avoiding it, because it's not, you're never going to get away with it. Just like we've not been able to get students to stop looking at phones and things like that, but rather to say, okay, so here's the clinical question that we have to answer. We have these tools, right? Okay, so how are we going to use these tools? And then let's look at what the output is. And then how do we use the outputs to come up with a synthetic application or a synthetic diagnosis? And that is no different than if I were to go online and go to WebMD and say, what are the 13 things that cause abdominal pain, right? And then I spit those back to you. That's no better, right? But if we say, okay, so you have the 13 causes, now how are you going to critically decide which of those causes is more likely, less likely? That's the critical thinking. That's the clinical synthesis and application. And that's the special sauce, right? I care less about where they get their data. I care that the data is accurate, and I care what they do with the data to synthesize new ideas.
I agree with Lori. I mean, it's one thing if I took those students or something and asked them, okay, when the indications were brought in our direction, then they could rattle it off.
Yeah,
from
it's
AI.
that,
But
right.
in the middle of the case, the one person, the resident might be able to tell me there's 38 steps to a brought in our direction, but she can't go from step 8 back to step 5 for something. So,
Right.
Something is different and she can't do it. Dr. Bear knows I've had this issue. AI can't help them in the middle of battle. Okay.
You're right. They can't help in the middle of the battle, which is why they have to do more practice. So if we had a simulation that went through the 38 steps of the carotid endarterectomy, and then we had the resident do the procedure, and then we had the simulation grade their effectiveness and what were the critical steps that were missed, and then a secondary case the AI generated that had those specific elements as the critical pieces, and then had them practice on that one, and so on and so forth. So the idea is using AI to identify the weaknesses of the learner and then generate new scenarios that help them to train those weaknesses.
A factor also that is important is using AI as part of a collaborative learning. So as students are into groups and they are looking for different things and they are complementing each other's learning. So they have different, for example, different case scenarios with different signs and symptoms, and they are coming together to discuss their AI generated cases and come up with a diagnosis and treatment options and all these aspects in a collaborative environment where they are sharing their prompts for AI, where they are sharing what they have learned, the other resources that they are finding at an initial stage of using AI that might be very helpful for them to learn from each other and with each other.
Yeah, I'll just add, I think I agree with all of this. And I think that something I think a lot about is, spell check. How many people turn off spell check? No one, right? We all use spell check and it helps us write better. You do? It helps us write better and faster, but it also takes away someone who's dyslexic or who is not a native, is an English language learner. They can use that tool to help them write efficiently and effectively. And we wouldn't want to take that away necessarily, right? The content might have been there, but the delivery or the syntax or the grammar or the spelling. I think the other piece, and we haven't really touched on it, it's not part of necessarily the ChatGPT conversation as a whole, but I think there is some value for thinking about, we brought up the intellectual, property, the ownership piece, and how I think there's a real concern, right, about AI coming in, and what if AI can now diagnose better? What if it can look at images? I just read a study the other day, an AI-based study could detect cancer 5 years before a physician could. So I think there's real concerns about, is it going to have false negatives, false positives, all of that, but also that wait a second, did it do my job better than me? Right? That feeling of oh, I don't want it to take my job, so I don't want to use it. But could that help that patient, right? Get treatment earlier, have better prognosis, have better quality of life. And so I think the double-edged sword, the caution is really, really important. I'm not saying to throw caution to the wind, but I think there is an element of humility, almost that concern, right? Of oh, well, I don't want it to be better at my job than me. But also, I think Dr. Conley brought it up earlier. How can we heard from the keynote, burnout. We're doing all these tasks that are not patient care. Are there ways to use AI to actually have more human interactions with patients and with other people? And can we use it as a brainstorming, a jumping off point or whatever, but really to center that humanity, those things that we can do person to person that the AI is never going to do. So just kind of different angle on it, but I just wanted to add that.
Yeah, I second that, because if there is a way that there is a foundational knowledge that the students can reach and can have before meeting the faculty and the education, so that the time spent with the faculty is more about clinical and cases and learning. So if I can be sure that through the AI and ChatGPT, they can obtain the foundational knowledge, then the time spent with them is more focused about skills and patient related aspects.
This conversation can clearly keep going, but will this continue? Dr. Misra, I'll have you maybe share your final thoughts and maybe what your singular 10-second, 20-second takeaway is. Mine is that we should keep having this conversation. And as a comment came in, you should share your key takeaway in a French accent. This was asked.
I'm almost positive that's a cultural appropriation. And if you hang around till 10 a.m. tomorrow, you'll know why that's a bad thing. I will simply say my key takeaway here is that like every other major technological advancement that has come in the history of humanity, we need to not shy away from this. We need to embrace it, but we need to be thoughtful about how we embrace it. We also need to recognize that it is not about us at our stages where we sit simply trying to implement it, that it has to be from the ground up. So it's not just how do the DSMEs, the coordinators, clinical preceptors utilize it? How do the students learn about it? And you all have the opportunity to start teaching students how to use it in the clinical setting. So embrace it cautiously, right? But embrace it because your learners are already doing it. And the longer you say, I'm not going to do it, the more you take yourself away from your learners. And at the end of the day, we want you to be close to your learners, not distant from them.
Awesome. Thank you so much.
Merci beaucoup.
There it is. Thank you. Thank you. Thank you to our panelists. Appreciate you all. Great discussion. Thank you to our audience for asking fantastic questions. Thank you for those bringing us here together, Dr. Davis, Tammy, Donna, and those in behind the scenes, our IT folks. Thank you yourselves. Thank you very much. Appreciate y'all.